Hello and welcome. I'm Dr. Sonali, scientific editor of the CAHO. On the occasion of World Patient Safety Day, we are bringing you a special podcast around this year's WHO theme, Patient Safety from the Start. Every child deserves safe care. Today, we will be joined by our esteemed guest to discuss how ensuring safety right from the beginning can shape healthier future for every child. Dr. Chetan Gingeri is the program director of pediatric and lead consultant in pediatric intensive care at Esther Hospital in Bangalore. So before we start, I would like to welcome Sir, and I want you to tell us a little bit about yourself and your journey as a pediatrician.
Thank you, Dr. Sonali, and thank you, CAHO, for having me as a guest into this podcast. So, I'm basically a children's ICU specialist, and my journey as a pediatrician started with interest around kids. It is very intellectually challenging to manage kids right from newborn till adolescence, period of 18 years. It is also very satisfying to be around children and families and looking at them recover from very, very critical illnesses. So, just all these factors led me to build a career in pediatrics and then into acute pediatrics as such.
Right, sir. So this year, as we are celebrating the World Patient Safety Day with the theme of safe care for every newborn and every child, from the beginning, as a pediatrician, what does theme mean to you?
So this is a very apt theme, and it couldn't have come at a better time. As pediatricians, we look after children right from newborn period till 18 years of age. And every age group has got its own physical, physiological, mental, emotional challenges. So this is basically a call to action in the healthcare system to develop robust safety nets depending on the age appropriateness of the child. So a newborn requires a different kind of a safety net. For example, a premature baby where in the NICU will require very strong infection control practices, whereas an adolescent will require a more mental emotional support during the illness, which also forms a broader kind of scope of safety. So this couldn't have come at a better time, and it is basically to strengthen our systems based on the age and the physiological, physical, mental, emotional needs of the children and their families.
I agree, sir. So similarly, like when there are different ages, when we are talking about the different ages for the children's here, what are the common risk or the harms these children face in healthcare setting? How can they be prevented?
So pediatrics is extremely kind of a learned uh, specialty. You will have to observe the child, and it takes experience to identify a sick child from a non-sick child. A baby who is crying, we have to understand whether the cry is for hunger or whether it is the cry for pain. So there is an element of experience fitted into the specialty as such. So right from identifying the diagnosis, then making the treatment plan, ensuring that all the drugs, the fluids are calculated according to the age and weight and the height of the child, to using appropriate equipments. Because if you want to do a pediatric surgery or a pediatric airway manipulation or put a child onto a ventilator, it has to be according to the size of the baby. And that is very, very important. So and apart from that, children, being children, they are curious and they are fearless. And when they are sick, they are also anxious and they want to reach out to parents all the time. So that sometimes results in fall risk. Okay, children getting anxious when parents are not around them. So it causes us to use more sedation, use more other drugs to keep them calm, which has got its own other side effects. So all these things, right from diagnosis, treatment, using the right equipment, falls in the hospital settings. And the other most important thing we need to remember is that children deteriorate very, very fast because their physiological reserves are very weak. So we need to monitor sick children in the hospital setting very, very actively. It cannot happen that something has happened and after that the medical team is reaching. The monitoring has to be active and early warning signs have to be identified on time and responded to appropriately.
Right, sir. So, is there any key steps that health system or the professionals can take to ensure the safe care from the birth or during the ICU time or NICU time?
So for that to happen, the whole healthcare system has to evolve to understand that children are not small adults. So there is a huge age range in which we manage children, and the newborn has got its own priorities, like we discussed earlier, strict infection control. Then the PICU has got its own priorities. We have to empower children and also the families. So families in pediatric care are co-carers. They cannot be a bystander. Okay, so we
Right.
have to utilize the power of children and families and also the healthcare workers to build systems and safety nets which are age appropriate. So the first message to the healthcare kind of systems are primarily to understand that children are not small adults, and we need to train the staff accordingly. All the trained staff in pediatrics have to be retained in that space and build capacity accordingly.
Right, sir. So, if you could send one message to the policymaker on this World Patient Safety Day, what it would be?
So, to the policymakers, it will be mainly that uh, empower, empower our healthcare workers, empower our children, empower families to participate in the care of children in the hospital setting, and kind of actively participate in the decision-making process in the care of the child while the child is in the hospital. And also, whenever there is something off, the nurse, the doctors, the junior doctors, the technicians, everybody has to be clued in to act appropriately, raise alarms early, use the warning score systems appropriately, and the moment it is any of the physiological parameters are out of range, it has to be brought to the notice, and escalation matrix has to be fast and decisive.
Right, sir. So, since we are talking about the empowerment and the WHO theme objective is also includes the awareness, the mobilization, and the research. From your perspective, which of these is the most urgent need of the hour right now, and why?
So,
Empowerment is one. You talked about that.
yeah.
Yeah.
So I would still emphasize on empowerment. With that, you can build on to the other kind of verticals of awareness, mobilization, and research. But first thing, I think anybody who's involved with care of children in a healthcare setting has to be empowered for advocating for the wellness of the child. So wherever they are with children, they if they identify some systems are off, some safety net is off, some child is in danger, they need to be empowered to act appropriately. And once empowerment happens, we need to kind of layer that empowerment with adequate training. So a set of newborn children nurses have to be trained very diligently on infection control practices. Children who are working in children's ICU or children's emergency need to have a lot of soft skills to handle children and their parents. Children who work with, staff which work with children with cancers have to have that empathetic attitude towards the child and understand the softer cues of pain and discomfort in that child. So every specialty of pediatrics needs empowered, aware, educated, and trained manpower to make it successful for and safe for children in a hospital setting.
Right, agree. So, in addition to that, so is there any innovation or strategy do you believe which holds the most promise for the safer pediatric or the newborn care in this decade, in the coming decade?
So basically, we'll have to leverage the technology to make safer systems. So triaging systems in emergency, triaging systems in the newborn care. Based on the physiological parameters, we can develop early warning scores, which can we can make algorithms so that we are able to pick a sick child before the actual physiological derangements happen. So that is one leverage technology we can do. But again, the traditionally, because children are different from little adults, we have to have a very good family-centered care, which by itself provides a good safety net for the children in the hospital setting. And these families and the staff taking care of the children and families have to be empowered to act the right way. So technology is there, but it is not as useful as in the adult world. technology has to be understood in terms of what is the age, weight, height of the child and the clinical context. It can be used for monitoring purposes of children in a hospital setting. Um, Algorithmic approach towards specific conditions, especially in critical areas like emergency and NICU, can be brought about. So these would be the innovations which we should think about in pediatric health.
So I agree. So there is anything that our listeners do or get involved in promoting the safe care for the newborn or the toddler age or the children?
So the listeners, if they are from a healthcare industry, if that is the kind of target audience, again, my emphasis will be to tell them that children are not small adults. And each age group has its own physical, physiological, mental, emotional vulnerabilities. A toddler needs to be treated with a lot of love and kept in the mother's lap as much as possible before we examine, before we try to take the child away from the parents. Whereas a school-going child from 6 to 12 years need to be spoken to with respect. And adolescents who really kind of don't have that relationship with the doctor need to be dealt with even more empathy and consideration, and giving them time and space for them to express themselves. So pediatrics that way is a challenging specialty, but it's a beautiful specialty. So all the healthcare workers, managers who are working, nurses who are involved in care of children, and doctors who are part of the pediatric department, it needs a little bit different worldview to take care of children and families, develop that compassion, develop that learning about the child's kind of physiology, and develop that keen eye so that as soon as you look at the child, you will be able to say this child is sick and this child is not sick, and accordingly manage the family as well as the clinical condition.
Right. So when we talk about the primary caregivers, the parents are the one who are actively there, and I think they are the ones who needs to be contributed towards the safer care. So how can we guide them? What is the method?
So the current day parents are overloaded with information through social media, through books, through other sources of information. So we as doctors will have to help them sieve out the unnecessary and inadequate and improper information from the right information. Second is because the current day social, cultural, economic demands are such that both the parents are working. So the primary care of the baby is left in the hands of grandparents or a nanny or a digital device. So we would encourage parents to be mindful parents, watch what kind of role model we are setting for our own children, what language we use for our children, and what safety practices we follow, so that children also follow those safety practices in their immediate environment. A father who jumps the signal while driving is going to make his own child jump the signal someday. So children are watching and observing. So that is why parents have to set good role models for safety. They have to be empowered with the right knowledge from the right source, and parents themselves have to be responsible in taking care of children mindfully.
Totally agree, sir, since we are living in the world of social media each day, every day. Sir, is there any concluding remark or any message you want to give to our listeners and viewers?
Through this platform of CAHO, I just want to again emphasize the theme of this World WHO Safety Day, focusing on pediatric and newborn age groups. It's very important that as a healthcare kind of fraternity, we understand that children are fragile. Children need additional care. For that, we need to build very robust safety systems. They are the future of our species, future of our country. And it is all our responsibility to ensure that they do not suffer harm when they come to spaces like hospitals. Thank you so much for this opportunity.
Thank you. Thank you so much, sir, for joining us today on this special episode of the podcast from the Spark on the occasion of World Patient Safety Day with the theme Patient Safety from the Start. Every child deserves safe care. We hope this conversation has highlighted the importance of safe, quality care for every newborn and child. Let us all work together, the healthcare provider, the families, and the community to make healthcare safer from the very beginning of the life. Thank you for the listening. Thank you, sir.
Thank you so much. Thank you.